HealthStat is an on-site healthcare provider of services.
Okay. So that means you set up clinics or have physicians or nurse practitioners at an employer's workplace?
Yes, ma'am. What we do is we go in and provide screenings for the employee setting, and then we provide those diagnostic tests for the employees and give the results back to those individuals, and then we take all those results and provide them to a clinician that's through our electronic medical record, so they have all the information so they could treat the patients based on their individual outcomes.
Right in the workspace.
Correct.
Can I ask you, what is the benefit for employers to have this kind of service versus just paying for traditional insurance for their employees to go elsewhere?
Well, the like kind cost for their healthcare services are cheaper than in the market that they could purchase otherwise, as well as the proactive nature of delivering the healthcare with those screenings that we mentioned, so they save on the medical cost spend for their entire employee population. They also have an increased productivity because the site is on site, and they're able to render those services. Typically, if somebody had an acute issue, they could go to the clinic at that point of time as opposed to having to wait 3 hours to go see a doctor or a nurse, and they're able to increase their retention based on that and their training cost.
Mm-hmm. Are you finding that employers are embracing this idea?
It's being very well accepted in the marketplace, more through word of mouth. We gain incrementally in our service each year through a diverse group of employers. Now we provide services to carriers and hospitals that we didn't have as clients before.
What is the benefit or really why should doctors coming out of medical school be interested in doing this versus the traditional route of joining a hospital or opening a private practice? That's
a great question. The clinicians that use our service find that they get to see the improvement of the population they work with over time. They also like it's different than a fee-for-service model where they're compensated based on outcomes of the population as opposed to being able to generate a fee for the services they render.
Okay. How fast are you growing?
We grow at a rate of 25% a year.
And what are you basing that growth on?
Clients, as well as hours that we deliver our service, or the sheer employees that engage into the service.
Is there anything that I've missed, Crockett, that you'd like to add here?
I think that you're seeing a tremendous change in the way healthcare is delivered in the United States, and I think the service of providing a knowledgeable resource on site for a stakeholder such as an employer is proven to be quite valuable in the employer setting today.
And finally, this is your first time at this particular conference, I understand. How are you finding the experience?
Oh, I think it's incredible. We see interest nationally and internationally, so it's well accepted. This seems to be the best conference that HealthStat attends of such nature as this.